I want to talk about the border, though. That's what I'm really concerned about. I just visited the border. My third trip there. It's certainly a humanitarian crisis, and I'm sure anyone that's been down there would agree with me that it's a national security crisis, but I want to talk about the healthcare crisis going on there. When I went down with a group of physicians 3 years ago or so, I was concerned about just the doctors, the nurses being overwhelmed. I was concerned about tuberculosis, hepatitis, scabies, sexually transmitted diseases, and other communicable diseases. But now, based upon what we know, the incidence of COVID is 5 to 25% of the people coming across the border. And then what I see is they take a group of folks, 50 to 60 people, they put them on one bus, and they do a couple of exams, and they all put them in some type of a dorm setting. So if they all didn't have the virus, they soon will, and then we let them go out into the public. That just seems hypocritical. You know, the application that you're talking about for when we can let ships come to Alaska, and the concern about variants from South Africa, that just seems hypocritical to me. While I respect completely where you're coming from, it seems like it's a double standard. Dr. Fauci, are you comfortable with what we're doing on the border from an ID standpoint?
The reason I would have to hedge on that, because I'm not really very deeply familiar with the details of what's going on at the border. And that's perfectly honest with you, Dr. Marshall. I really am not familiar enough with the situation at the border to be able to make a comment. If I was, I would.
Whose job is it to know that?
I can chime in and say that I am aware that at CBP sites that there's overcrowding and that we need to, from an infectious disease standpoint, from a COVID standpoint, we need to de-densify what is happening at CBP. We have been working closely with ORR as our children leave CBP and move to the ORR sites to work towards getting them screened and tested, which is why they have, you know what % positivity they have there. Those ORR sites are much improved compared to the CBP sites with regard to how those children are cared for, who is caring for them, and we are providing technical guidance on those ORR sites to work to make sure that they are as safe as possible using mitigation strategies at their
But do you see the hypocrisy in what we're doing to America? We're saying that I can't have a barbecue with my entire family on the July 4th. I can't have Easter service worship together. But we're going to let people come across the border in mass numbers and just release them into, does that not seem hypocritical?
I think there are two different situations that we have to handle. We have to handle in two different ways, and we have guidance and strategies for how we're providing technical guidance for the challenges that are occurring in the density at the border, and then we're trying to keep the public safe using evidence-based strategies there. Thank you.
Thank you. I yield back.
Thank you very much.